Hey everybody, welcome to Fun Facts. If you are seeking information, you are at the right place. Today, we're going to go over the most amazing top 10 facts about public health. Make sure to watch until number 1, because it's one of the most amazing facts you will ever see. Number 10. Public health, which includes sanitation, personal cleanliness, infectious disease control, and health service organization, as well as the art and science of avoiding disease, prolonging life, and enhancing physical and mental health. The importance of community activity in the promotion of health and the prevention and treatment of disease has emerged from the regular human interactions involved in dealing with the numerous challenges of social life, and this is embodied in the idea of public health. Number 9. Social medicine and community medicine are similar names for public health medicine. The latter is commonly used in the United Kingdom, and practitioners are known as community physicians. The practice of public health is significantly influenced by medical science and philosophy, and it focuses on regulating and controlling the environment for the public good. As a result, it is concerned with housing, water supplies, and food, farming, fertilizers, insufficient sewage disposal and drainage, construction, poor heating and ventilation systems, machinery, and toxic chemicals can all bring harmful substances into these environments. Public health medicine is an important aspect of the larger effort to protect and improve the public's health. Architects, builders, sanitary and heating and ventilation engineers, factory and food inspectors, psychologists and sociologists, chemists, physicists, and toxicologists are among the many organizations with which community physicians collaborate. Occupational medicine is concerned with the health, safety, and well-being of employees. It can be thought of as a specialist branch of public health medicine because its goal is to eliminate dangers in the workplace. Number 8. The endeavor of protecting, maintaining, and actively promoting public health necessitates unique means of data collection and corporate frameworks to act on and implement major discoveries. Epidemiologists use statistics to try to explain and describe the occurrence of disease in a community by linking factors like nutrition, environment, radiation exposure, and cigarette smoking with disease incidence and prevalence. The government sets agencies to manage and formally examine and monitor water supplies, food processing, sewage treatment, drains, and pollutants through laws and regulations. Governments are also concerned about epidemic and pandemic illness control, as well as setting recommendations for appropriate medical responses and isolation techniques, as well as issuing travel advisories to avoid disease spread from afflicted areas. Number 7. On a national and worldwide level, various public health agencies have been established to aid in the control and monitoring of disease throughout societies. The Public Health Act of 1848 in the United Kingdom, for example, established a separate public health ministry for England and Wales. The Centers for Disease Control and Prevention in the United States studies and coordinates public health on a nationwide basis. On a global scale, the World Health Organization serves in a similar capacity, who is particularly crucial in assisting developing nations with the implementation of organizational and administrative systems for dealing with health and disease-related issues. Health issues, resource constraints, health personnel education, and other considerations must all be considered while establishing health delivery systems in these countries. Number 6. In affluent countries, advances in science and medicine, such as the development of vaccines and antibiotics, have been critical in giving critical aid to countries with a high burden of disease. Despite increased resources and improved mobilization of these resources to the most seriously afflicted places, the incidence of avoidable disease and neglected tropical disease continues to be extremely high over the world. A key goal of international public health is to reduce the impact and prevalence of these diseases. The survival of such diseases around the world, on the other hand, serves as a stark reminder of the challenges that health organizations and society continue to face. Number 5. A look back at the history of public health, which dates back to ancient times, demonstrates how different public health conceptions have evolved. In the Middle Ages, leprosy victims were quarantined, and efforts to enhance sanitation were made following plague epidemics in the 14th century. As Europe's population grew, there was a greater awareness of newborn fatalities and a profusion of hospitals. As a result of these advances, contemporary public health agencies and organizations were established, with the goal of controlling disease within communities and overseeing the availability and distribution of medicines. Number 4. The majority of ancient peoples in the globe practiced cleanliness and personal hygiene, frequently for religious reasons, including a desire to be pure in the eyes of their gods. Many adjurations and prohibitions about clean and dirty life can be found in the Bible. Religion, law, and tradition were all inextricably linked. For thousands of years, societies viewed epidemics as heavenly punishments for humanity's sins. However, the notion that plague is caused by natural factors such as climate and physical surroundings grew over time. This major shift in thinking occurred in Greece between the 5th and 4th centuries BCE, and it was the first attempt at developing a rational, scientific account of disease etiology. A link between malaria and marshes, for example, was discovered quite early, despite the fact that the causes for the link were unknown. Number 3. The Public Health Agency of Canada is the federal agency in charge of public health, disaster preparedness and response, and infectious and chronic disease prevention and control in Canada. Since the 1959 Cuban Revolution, the Cuban government has invested heavily in improving the health of its whole population by providing universal access to health care. Infant mortality has decreased dramatically. Cuban medical internationalism has resulted in the Cuban government sending doctors as help and export to countries in need in Latin America, particularly Venezuela, as well as Oceania and Africa. In building the welfare state, including public health, the French Third Republic lagged well behind Bismarckian Germany and the United Kingdom. Tuberculosis was the most feared disease of the day, afflicting young people in their 20s in particular. Germany implemented strict public cleanliness measures and established public sanatoria, but France relied on private physicians to tackle the situation, resulting in a significantly higher fatality rate. The medical profession in France jealously defended its prerogatives, and public health campaigners were not as well organized or powerful as in Germany, the United Kingdom, or the United States. For example, in the 1880s, a drive to reorganize the nation's health services, demand the registration of contagious diseases, establish quarantines, and repair the poor health and housing legislation of 1850 erupted. However, bureaucracy, politicians, and physicians opposed the reformers. The proposition was argued and postponed for 20 years before becoming law in 1902. Number 2. Public health practitioners can be educated and trained in schools of public health, medical schools, veterinary schools, nursing schools, and public affairs schools all over the world. Biostatistics, epidemiology, health services administration, health policy, health education, behavioral science, gender issues, sexual and reproductive health, public health nutrition, and occupational and environmental health are among the key topics that must be studied. The field of public health education has advanced dramatically globally in recent decades, thanks to the backing of organizations such as the World Health Organization and the World Bank, among others. Strategic concepts govern operational structures, while competency frameworks guide educational and career paths, all of which must be modulated in response to local, national, and global realities. Number 1. Public health degrees. Schools of public health offer a wide range of degrees that can be classified as either professional or academic. The Master of Public Health and the Master of Science in Public Health, MSPH, are the two most common postgraduate degrees. Doctor of Public Health and Doctor of Philosophy degrees are available in this field as subspecialties of larger public health disciplines. The Doctor of Public Health is considered a professional degree, while the Doctor of Philosophy is considered an academic degree. Professional degrees are geared at working in the public health field. Degrees such as the Master of Public Health, Doctor of Public Health, Doctor of Health Science, and Master of Healthcare Administration are geared toward people who want to work as public health practitioners in health departments, managed care and community-based organizations, hospitals, and consulting firms, among other places. Master of Public Health degrees are divided into two types: those that emphasize epidemiology and statistics as the scientific foundation of public health practice, and those that cover a wider range of approaches. A Master of Science in Public Health is comparable to an MPH, but it is an academic degree that emphasizes scientific methods and research. The distinction between the DRPH and the DHSC is the same. The DHSC is an academic degree, while the DRPH is a professional degree. Academic degrees are geared toward those who want to work in research. university teaching in graduate programs, policy analysis and development, and other high-level public health roles who are interested in the scientific underpinning of public health and preventive medicine. Subscribe and turn on notifications to get informed so you don't miss more videos of the most amazing top 10 facts and much more. Check out this playlist for other amazing top 10 facts. And remember guys, knowledge is power. With AP. Peace.